My name's Stewart. I'm a pharmacy owner and pharmacist in the northwest region of WA, Karratha and Port Hedland. My journey as a pharmacist actually began in Karratha. Karratha is situated about 1,400 kilometres north of Perth. I came here initially as a student and I really love the experience. I love the workplace, I love the people, I love the town. And so when it became time to choose somewhere for an internship, that was just a natural progression for me. I guess that's something I really wanted to do. So I applied and I got the position and came up here and did my internship, qualified, and I suppose that was the start of my career as a rural pharmacist. And spent a few years just working really hard, getting to know my patients, connecting with the healthcare teams on the ground, building up my reputation, I suppose, as a pharmacist. And as I sort of worked away and became more familiar with things, I worked my way up the ranks to become then a manager of the pharmacy. And that was really great because at that point in time, I was able to take control of some of the recruitment aspects and I guess start recruiting other like-minded people who are really passionate about rural health like I was. So that sort of led me down the path of creating this kind of vision of what rural healthcare could be in these remote areas, forging our own path and starting up lots of professional services that were never in the region before. Once I'd got more people on board, more like-minded people, and I could see the synergies and I guess the results we were achieving and how well it was received in the town, I think from that moment I decided that I was really interested in ownership so that I could carry that on, I suppose, into the future. I think all pharmacists should take a moment to consider working rurally, whether you're a new pharmacist or you're established in your career and just looking for a change. I guess two things. So professionally, the opportunities are really amazing. I think you get the opportunity in a rural environment or in a small community to create great connections within your community for the benefit of your patient. So for example, a diabetic patient, just by virtue of the relationships you build up over time, you probably personally know their GP, their podiatrist, their optometrist, their physiotherapist, occupational therapist. And so really always you're working kind of this multidisciplinary way. And I think that's really unique to rural and allows you to guide the patient. And the other thing is personally, you just meet the most amazing people in rural areas. And I think in the Pilbara specifically, we seem to attract people with a bit of a sense of adventure. And I think it's that kind of adventurous spirit that ties us all together. And so whilst we work really hard professionally, we also like to have a lot of fun. There's no bigger reason than that to give it a try. I'd like to look back one day and know that we did everything that we could to bring high quality healthcare to the Pilbara and to deliver the healthcare that the people of the regions really deserve. And I think being part of 777 allows us to sort of really make that dream a reality every day.